Well, first off, I want to make sure everyone has at least seen my updated version of the Marquette privilege license video that oddly kind of took a life of its own. We didn't really see that coming. In full disclosure, we've been doing the news for 4 years and I've never seen quite the response that we got from that video. But hopefully, we've cleared the air on a few items that were maybe being discussed pretty heavily, especially the fact that Marquette is in Wisconsin. We may now say that on every show just to make sure that the air has been cleared and the record has been set straight. In other news, this is kind of an interesting story because I think it starts to set some interesting discussion points around this jurisdiction of decision making that happens at the state board. So just for a little background information, some states have dental boards that operate fairly autonomously. They are filled with open positions from dentists or a dental hygienist or members within the dental industry or in the state. In other states, they are filled with politicians, legislators, members of public health, individuals, maybe or maybe not specific to dentistry. So each state board's composition can look very different. Well, this story came out of Alaska, and yes, in fact, that is the state. The story made headlines because this particular dentist became famous on Instagram or social channels for posting a video that went viral of him doing a sedation case, oral surgery on a hoverboard. And the way that the headline reads, you would think, well, that must be the big story, the fact that he was performing dental surgery on a sedated patient on a hoverboard, but that really wasn't the big piece of the story. In fact, when they started digging in to this patient or to this dentist's history a little bit deeper, they found, at least allegedly, in the stories that we've read, some fraud and misbilling tactics and a few other nefarious activities that may have been going on. The hoverboard and video just brought him to public spotlight, highlighted the patient that was sedated who hadn't consented to the video, who then moved forward with charges against the doctor, which opened up a tremendous amount of liability for the doctor and all the other things that they discovered. Okay, why is the story interesting other than the fact that the doctor was on a hoverboard? Because the state dental board decided to revoke the doctor's license and stated that his activities, there was a whole laundry list of things that they had found in the practice, were not at standard of care, and so they were going to remove his license. The state Supreme Court backed up that decision. So they stood behind the dental board and said, yes, in fact, you have the authority and autonomy to make that decision. Now, that may not be true in every state, but at least in Alaska, that was the final ruling. Now, this gentleman actually stands to serve prison time for many of his activities. So it's not just going as far as losing his license. He is actually going to be sentenced for many of the alleged crimes that he's been charged with. But I think it sets up an interesting discussion as we've been talking about licensure and state dental boards, that the Supreme Court of the state of Alaska did uphold the dental board's autonomy to make that decision about an individual.
Another interesting news story for this week comes out of the great state of Oklahoma. We have a dentist there that comes to the aid of a woman in his community. Now, this isn't the first time that I've known dentists or seen stories about dentists who ultimately come to the rescue of a local community member, not just a patient. I do think it's an inherent quality of most dentists that we want to take care of people. And if we see someone in duress, we're going to do everything we can to help them out. I think it's one of the necessary qualities of a really good dentist. Well, Dr. Keith Montgomery in Oklahoma City is no exception to that rule. You see, when he discovered a female laying outside unresponsive, he suspected an opioid overdose and happened to have naloxone in his pocket to be able to administer, thus waking the patient up and bringing her back to consciousness. Now, why was a dentist walking around with that particular reversal agent in his pocket? Well, you see, Dr. Montgomery had experienced the loss from opioid overdose himself. He lost his daughter after being 4 years sober to one night of taking one pill that caused an opioid overdose. And he didn't want another individual to be victim to that particular scenario. So now he walks around with that reversal to help anyone else out in distress and to hopefully save their life while in that particular scenario. And it's his message to others that we should all be proactive in helping others avoid an opioid overdose, because you never know when it might just have been that one occurrence of an accidental exposure to a medication. You thought it was something and it ended up being something else that ends up taking a precious life. And that's the news.